Hi, let's talk about autonomics, specifically the sympathetics of the head and neck. In this video, we'll discuss the autonomic nervous system and how it's constructed, how the sympathetic division of the ANS is structured, the four basic pathways of preganglionic sympathetic fibers, and the major sources of sympathetics to the head and neck. But first, let's take a look at the general autonomic nervous system. So the autonomic nervous system, or the automatic nervous system, is a means by which we can control all the little details of our bodies that we don't want to think about, such as heart rate, respiration, the conversion of glucose, the contraction of smooth muscle, etc. And so all of these things are dually and antagonistically innervated by the divisions of the ANS. There's the sympathetic division, which we call the fight or flight response. These are the elements that prepare our body to either fight or flee to a fight. So elevated heart rate, elevated rates of respiration, dilation of the pupil, sweating, the conversion of glycogen into glucose, the contraction of smooth muscle, etc. The other side of the autonomic coin is the parasympathetic, or the rest and digest. These are the elements that are going to enable us to calm down and to move foodstuffs through our alimentary canal. So we would have a depressed heart rate, a depressed rate of respiration. Our pupils would constrict. The smooth muscle lining our gastrointestinal tract would contract. Our glands would secrete. Our vasculature, the smooth muscle in the walls of our vasculature, would relax ever so slightly. And so at any given time, there is this balance between the sympathetic and the parasympathetics. Now, very quickly, the parasympathetics are known as the craniosacral outflow, so cranial from cranial nerves and sacral from the sacral spine. But in this course, we're going to focus more on the cranial end of the craniosacral outflow. And we'll discuss cranial nerves 3, so that's oculomotor, 7, facial, glossopharyngeal, which is 9, and vagus, which is 10. And we can see them here on this brainstem model. So cranial nerve 3, the oculomotor nerve, emerges from the brainstem there, and it provides preganglionic parasympathetic fibers out to the ciliary ganglion. The ciliary ganglion is serving the eye. So we can see that going out through there. So things like the sphincter pupillae muscles of the eye and the ciliary muscles of the eye to accommodate the lens for accommodation are a function of cranial nerve 3. Cranial nerve 7, the facial nerve, emerges from the brainstem there. And we can see that cranial nerve 7 serves 2 ganglia. There's the pterygopalatine ganglia, the pterygopalatine ganglion. So those preganglionic parasympathetic fibers synapse in that ganglion, and that ganglion is going to serve the lacrimal gland for secretion, as well as the mucosa, the glands of the mucosa of the nasal cavity. 7 also is going to provide the preganglionic parasympathetic fibers out to the submandibular ganglion, which is going to serve the submandibular salivary gland as well as the sublingual salivary gland. And then we have the glossopharyngeal nerve, which is originating from the brainstem there. Glossopharyngeal or cranial nerve 9 does quite a lot of things, but it provides the preganglionic parasympathetic fibers to the otic ganglion, and that otic ganglion then will have postganglionic fibers serving the parotid gland. And then cranial nerve 10, the vagus nerve, is going to be a very big player in the neck and the autonomics of the thorax in particular, and then the autonomics of the abdomen, but there are no ganglia that are served by 10 in the head. So vagus is a very big player throughout the neck and the thorax and the abdomen, but there are no preganglionic parasympathetic fibers heading to the head. It's very important to note that those fibers of 3, 7, and 9 on the way to their targets are going to hitchhike with various branches of the trigeminal nerve, and we'll see that throughout the various sessions of the course. So this video is more focused on sympathetics, or that fight or flight response, and so let's discuss the overall structure of the sympathetic division of the autonomic nervous system. So the sympathetic neurons, they originate in the hypothalamus. They make their way down through the brainstem and the length of the spinal cord. They actually originate in the lateral horns, also known as the intermediolateral nuclei of the spinal column, or the IML, and they make their way out of the ventral rootlets and the ventral root through the spinal trunk and out to the ventral primary ramus, where from the ventral primary ramus, white rami communicantes connect these fibers through to the sympathetic trunks, and we can see the sympathetic trunks there and there. Those white rami communicantes exist at the spinal levels T1 through L2. So that's why we say that the sympathetics are the thoracolumbar outflow. So all of the thorax and a little bit of the proximal lumbar spine have these white rami communicantes. So they're carrying the pre-ganglionic fibers to the sympathetic trunk. And it's in the sympathetic trunk where most of these fibers are going to synapse, and they'll do stuff, and we'll talk about that stuff that they do. And then many of them come back to the ventral primary rami via gray rami communicantes. These gray rami communicantes are going to return to VPRs at every spinal nerve level. And so we see gray rami communicantes, the entire length of the spinal cord and beyond. With respect to the head, sympathetic fibers to the head are sourced from the superior cervical ganglion of the trunk. And those fibers go on to perivascular plexuses, so they're going to travel along blood vessels as conduits to their targets. So let's take a look at some of what I was describing earlier. So here is that IML of the lateral horn. And those presynaptic fibers, they come from the IML and they exit via the ventral rootlets to the ventral root out through the trunk. So there's the DPR. We're not going that way. Here's the VPR. And so here's our ventral primary ramus coming out. And we see that here is a white ramus communicans. So that's the singular of rami communicantes. And those preganglionic fibers are traveling into the sympathetic trunk here. Sympathetic trunk consists of a series of ganglia which are connected by fibers. Good. So once we get to that sympathetic trunk, and I'll just outline the trunk here. So there's trunk, ganglion, trunk, ganglion, trunk, ganglion, more trunk, etc. So we'll have one of these on either side of the vertebral column. Once that presynaptic fiber gets to the trunk, there are a few things that can happen. The first thing that it can happen is, very simply, it synapses with a postganglionic or postsynaptic fiber, and then it travels back to the VPR via a gray ramus communicans, and then it can be distributed throughout dorsal and ventral primary rami. So it can synapse and then head right back to the VPR via a gray ramus communicans. Another thing that can happen is that it could, here, let me erase some of this. That preganglionic neuron can get to the sympathetic trunk and it can descend. It can go down and it can synapse in another ganglion at a different level, and then it can travel back to the spinal nerve via the gray ramus communicans there and be distributed throughout dorsal and ventral primary rami. So that's the second thing that can happen. It can descend the trunk before it synapses. Let's erase this. The third thing that it can do is come to the trunk. Well, there's the preganglionic fiber. Come to the trunk, and then it can ascend and synapse, or continue to ascend and synapse before returning via a gray ramus communicans to the spinal nerve via the ventral primary ramus, but also distribute to the dorsal primary ramus. This is going to be an important pathway for the sympathetics for the head, because we'll have sympathetic fibers from, we'll have preganglionic sympathetic fibers from the thorax that make their way all the way up the cervical sympathetic trunk to get to the superior cervical ganglion before synapsing and then heading out to the head. The fourth thing that can happen, let's erase all of this here. The fourth thing that can happen that you should be aware of, but is not going to be a part of what's going on with the head or the neck, is that the fibers that come in, those preganglionic fibers, let's just come from this level because that's already highlighted or drawn, they enter in through the white rami communicantes, or this white ramus communicans, and then they leave the sympathetic trunk without synapsing at all, and they participate in collections of these fibers called splanchnic nerves. These splanchnic nerves are going to serve the abdominal viscera, but again, we don't see these in the head and the neck. So those post-ganglionic fibers, just to reiterate, they're coming back to spinal nerves via the gray rami communicantes, and this happens at every single spinal nerve level. So whereas the white rami communicantes are between T1 to L2, that's the outflow, the gray rami communicantes are at every level. And that's because we have fibers that are ascending or descending the trunk. Some of those preganglionic fibers, so these are not going to be postganglionic fibers, some of those preganglionic fibers, they leave without ever synapsing, and those become splanchnic nerves. So this is a posterior view of the pharynx, and we can see a little bit of the contents of the carotid sheath over here, but I want to draw your attention to this. That would be the cervical sympathetic trunk, and we can see 3 ganglia here. There's our superior cervical ganglion. Here's our middle cervical ganglion, and then there's our inferior ganglion. Let's turn our attention to the superior cervical ganglion because this is the one which is so very important for sympathetics serving the head. The superior cervical ganglion is likely the fused ganglia of spinal levels C1 through C4. We presume that because the gray rami communicantes go back to spinal nerves C1 through C4. And the postganglionic fibers that come from here are servicing the head. Usually they're traveling along either the spinal nerves or through the perivascular plexus of the internal carotid artery. And whether it's through the spinal nerves or the internal carotid artery, we have various vasomotor fibers. Those vasomotor fibers are going to the smooth muscle of the vasculature to cause it to constrict when required, or pseudomotor, which are going out to the sudoriferous glands. There are also branches from that internal carotid plexus serving the dilator pupillae muscles of the eye and the smooth muscles of palpebrae, such as the smooth muscle portion of levator palpebrae superioris. The middle cervical ganglion is very frequently absent. We presume that it represents fused ganglia from C5 and C6 because those are the spinal nerves that when it's present, it sends gray rami communicantes to. That middle ganglion will send branches to the thyroid gland, as well as branches to the cardiac plexus in the thoracic cavity. And most of these fibers are vasomotor, so it's providing innervation to the smooth muscle of the vasculature. And then finally, this inferior cervical ganglion represents fused ganglia at least of C7 to C8, oftentimes T1 or beyond. When it doesn't include the T1 ganglia, we just refer to it as the inferior cervical ganglion, but when it combines with the T1 ganglion, we call it the cervico-thoracic or stellate ganglion. This tends to be quite a large ganglion when it combines with thoracic ganglia, and it's often a very impressive size, but not quite the size of the superior cervical ganglion. If you are lucky to see the thoracic ganglia of the thoracic trunk, you'll note that there are ganglia for every thoracic level. So you'll see one associated with every rib on the way down the thoracic sympathetic trunk. So that leads us to our assessment question, and that is, ultimately, the sympathetic fibers serving the head are sourced from or traveling through which sympathetic ganglion? Is it the cervicothoracic ganglion, the inferior cervical ganglion, the middle cervical ganglion, the stellate ganglion, or the superior cervical ganglion? Well, cervicothoracic, inferior, and stellate can be referencing the same thing. They're not necessarily the same thing, but they're often referencing the same thing. It's not the middle cervical ganglion, it is the superior cervical ganglion at the superior portion of the cervical sympathetic trunk, serving the head via either gray rami communicantes to cervical spinal nerves, or more often than not, the internal carotid plexus. Thank you very much for your time.